All right, what up? This is Joe, and from me to you, my guest today is Passion for Academia has provided herself with the opportunity to change curricular for education in countries abroad, with credentials coming from Fisk University and Vanderbilt, a Fulbright Scholar Award winner and tenure professor. We have Dr. Courtney Nyange. What's going on, Courtney? How you doing?
I'm good. How are you?
I am good. I am good. Thank you for being here with me. I'm glad you can join me for this episode. So what I like to do, kind of introduce you to kind of the world and get to know yourself a little bit more, just to kind of get the origin of Dr. Courtney. Could you tell me a little bit about your parents? Who are your parents? Where did they grow up? Kind of a start like that, so kind of get to know you a little bit better.
So, my family is originally from Memphis, Tennessee, but I myself was born in Maryland. My parents were in the military, Navy, so we kind of traveled around, moved around a lot. So, I spent a lot of time, let's see, between Memphis, North Carolina, here in Nashville, as well as Louisiana. I've just kind of like a little bit of a nomad, just going from here to there and finally finding somewhere to settle down and just be.
How was that kind of being like in the military, moving around and around the
You know,
experience?
it was difficult in some parts of my life. Like growing up, let me see, I'll say the earlier years, it probably wasn't too bad, but the older I got and had, more connections with friends and stuff, it got to be very difficult to leave. So I was glad when my mom retired and we finally moved back here to Nashville and just had somewhere to stay. But I think it definitely shaped me into the person I am today because I don't have a problem with change and I don't have a problem moving around, and doing something different. So it has its pluses and minuses, but it was still great.
Yeah, no, definitely for sure, and I like that now because nowadays, like you said before, you were kind of maybe not able to keep in contact as much earlier in the childhood, but now they have like social media and different things like that to kind of keep engaged, even if your parents may be in the military and moving around. So you're not so much as a loss as you would be nowadays, I would say, compared to in the past. So
Yeah, we
yeah,
used to definitely write letters
yeah,
to friends. Yeah, me and my friend Tiffany, actually, we corresponded a lot via mail
yeah.
just to keep in touch back in the day. But yeah, now, text messages, Facebook, and just FaceTime, everything. You can see people and be connected still. So it's not that big of a deal anymore.
Yeah, no, that's cool, definitely. I was going to ask you where you're born. You said Maryland, so that's cool. But so, what would you consider your hometown? I know you kind of travel from place to place to place.
Yeah, so I call Nashville home because I've spent the majority of time here, especially my adult life, my college life, post college life. So, yeah, Nashville's home.
Yeah, no, for sure. I can see that. So, being that Nashville is home, what would you say? Because Nashville's changed so much, especially over the recent years. What would you say has changed, or a change that you've noticed that has shocked yourself compared to back then that you've noticed now, I guess, or something that you may even miss that we don't have anymore in regards to maybe the community or anything culturally that has changed now from then?
Hmm. I remember being in college at Fisk, and I was telling my friends, I was like, y'all, one day Nashville is going to be the it place, because at that point, then I started seeing some changes and everything. They weren't as drastic as they are now, but I could sense it, I think, though, that there have been a lot of developments and actually more increase in knowledge just about different cultures and everything with the changes. Um, there's been some good and bad things too, though. Just being at Fisk, when I was there for college and everything, and just the atmosphere there, it's really changed. The neighborhood has changed. A lot of gentrification. With just changes to the demographics of who lives in those areas now. It definitely used to be more of a more black community, but now you go down the street and you see these skinnies, the little houses, all these different architectural houses and everything, and it's change isn't necessarily a bad thing, but when it comes at the expense of the community, the people who are living there already, then it's not the greatest either. So that but I think with cities like Nashville growing the way that they are, like I don't think that you can necessarily stop gentrification. Um, but I think that we need to do a better job with making sure that the people who were there first can stay there if they still want to stay there, you know. Um, but I think there's lots of different things coming up, you know, and cultural things that allow us to get involved and learn more. You know, we've got the, what is it, the Museum of African American Music and everything that's coming up, you know. So I think there's some good things that are coming and happening in Nashville, but still there's the part of the people too, you know, that can't afford to stay here, that have to keep getting pushed out, you know. So I don't know. I don't necessarily know the answer to how to fix that, but I know it's a problem. But
Yeah, definitely.
yeah,
No, I can understand that because Nashville is very expensive. So, because you have to have at least a certain set of income to be at least to sustain by yourself
right,
without any kind of help. So, myself, even like you were saying, how the gentrification has came in and they got the tall, skinny flats and all that good stuff. And even myself having like little odd jobs here and there. I just recall like I was doing Uber for like a little minute, just having people come in from out of town, but the gentrification has taken over, and they're in the oddest neighborhoods in which this neighborhood 3 or 4 years ago was known or riddled with crime. But
right,
now you have these people coming in from out of town. They're staying in the tall, skinny flat, but right next door to it is still it's still the same bad area, but these
right,
people are unknown and coming in from out of town. It's just a shock to see
yeah,
that stuff has changed so much, and these people are unaware that some you go to any city and get an Airbnb or something like that. You really,
hmm,
unless you're not familiar with the area, you're probably not aware of your surroundings and
right,
things like
right,
that. So it's just kind of funny to see how like the city has changed so much, and just with that aspect, I kind of noticed that just doing odd jobs
yeah.
here and there. But that was funny that you kind of mentioned that, or I thought that was interesting that you had mentioned that as well.
Yeah, because I myself, I don't even live in the city limits, you know,
Yeah.
because it is so expensive. You know, I live on the outskirts. So, yeah, it's expensive to stay in the city. Like you said, people have to have a certain level of income, you know, just as if you're single,
Yeah.
married, okay, it's a little better, but still, you know, you still want to have some money to live too after you pay your mortgage or rent.
Yeah, no,
And
for
and
sure.
it's
And I definitely
crazy.
agree. I definitely agree. So, my next question is because I want to kind of stay early here and just kind of figure out a little bit more before we kind of get into your like a little bit more into your education and career. I guess we can kind of talk about your high school experience because in high school you kind of come to like a point in time where you're forced or not forced, or you got to figure out a path for yourself. So some people maybe choose vocational, some people may choose secondary or college, things like that, or some people just may be done with high school and just kind of just do their own thing, which works well for any individual. That's their choice for sure. So I guess during your high school experience, what kind of gave you the opportunity to say, hey, I want to kind of push for a little bit more education and go to the next step? Like, what did you notice from your peers, or what did you not notice from your peers that maybe gave you the extra passion to kind of go further?
Yeah. So I had my high school experience in two places. I spent my freshman and sophomore year in Louisiana, and then when we moved back here, then my junior and senior year were here in Nashville, and I graduated from McGavick. So yeah, but so when I was in Louisiana, that was a great experience down there. You know, just socially. It was a lot of fun, a bit of a change because they wore uniforms and all that stuff. So anyway, I got into ROTC while I was there, Air Force Junior ROTC, and that was like a big thing down there. I also was on the dance team and stuff. Because I was already doing that from in Nashville and then wanted to continue. I was in band prior to moving down there, but all they had was marching band. So I was like, no, I'm not doing marching band. I'm gonna get to this dancing. But yeah, just being around my friends there, I was always pretty smart though, so I had a lot of honors classes, and people really kind of looked to me to help a little bit with with homework and all that stuff, I excelled academically. When I got back to Nashville and went to McGavick, I wanted to go to McGavick because my friends from my previous time here, because we lived in Nashville first and then moved to Louisiana. So I wanted to reconnect with those friends, and be back around them, So in my way to do that was because McGavick had ROTC, Air Force ROTC. So I was able to go back there, and get into ROTC. It wasn't as big of a thing here, though, people weren't excited about ROTC here like they were down in Louisiana. I mean, like, down in Louisiana, we were, like, so excited to run our little drills and our formations, and just do all this type of stuff. But I was in honors classes here in McGavick and stuff, too, and my friends around me really just pushed me to kind of be that, because they knew that I was smart, and they're like, yeah, go and get in those honors classes and do what you need to do, So I don't know. I guess, too, my parents, they always encouraged me, and just pushed me in the right direction academically, So for me, it was like a given, but I really didn't know where I wanted to go, when I decided to go to college. I'll tell you, and a lot of people say this about Fisk, but Fisk really did choose me, because I had no idea really about Fisk, and I was living here in Nashville, and I'm
really?
like, yeah, no idea. I had no clue about the Fisk Jubilee Singers, anything. When I was thinking about college, I was thinking about Spelman, So when I had a classmate who was in the honors English class with me, and she brought me an application from Fisk from her church, and she was like, hey, you need to apply to this school. And I was like, okay, I don't know nothing about this school, but okay. But I looked it up, and that's when I was like, oh, like, this really is a great school, And so that's how, my segue into Fisk came. But they also offered me an academic scholarship, and I was like $10,000 short, and that academic scholarship was $10,000. And I was like, oh, this seals the deal for me. I'm going to Fisk. I did get accepted to Spelman, but they didn't want to give me no money. They just wanted me to take out loans, and I was like, oh, I can't do all that, So,
Yeah, no, I feel you.
but just, I don't know, my friends, my parents, my family, everybody always just pushed me to continue to strive, academically. That was my strong point. I did dabble in cosmetology and all that stuff too, when I was at McGavick, but I've just been academically, advanced, I'll say. And so for me, it was a given to go to college.
Yeah, no,
Yeah.
for sure. Because I was going to ask you a couple. Well, I'm going to ask you first because I know you mentioned ROTC. Because it was funny that you mentioned ROTC was big down in Louisiana. But once you got here, I myself, I went to McGavick as well, and I didn't think it was a big thing at our particular school as well. So I was going to ask you, like, why do you think the ROTC? I'm just curious myself. Why do you think it was so much of a big thing down there in Louisiana and then not here in Tennessee? What do you think? Like, what would you think the reason behind that is?
Well, I'll say where we were in Louisiana, we were stationed. My mom was stationed on the Air Force base.
Okay.
Although she was in the Navy, she always got stationed with either Marines or Air Force or something like that. So we lived in the town where the Air Force base was and went to
Okay.
school there. So I think just a lot of the kids there just really saw a big military presence, and
Yeah.
just really probably looked up to a lot of those people, several of their parents and stuff probably were in the military too,
Yeah.
So although here in Nashville, they got the Marine place on White Bridge Road,
Okay.
which my mom she was stationed there too, but just, I guess, having the base there in Louisiana and it really kind of being like a little military town probably, made people just gravitate more towards the Air Force Junior ROTC versus here.
Yeah, and I can understand the influence in that for
Yeah,
sure.
yeah.
Definitely. All right, that's pretty cool. All right, so I guess you kind of talked about your peers and your family. I guess who would you say would like be your biggest influence or mentor that you would say at this particular point, I guess, before you transitioned into college?
Have to be my mom. Have to be my mom. Yeah. My mama, she's great. She did her thing in the military. She went all the way up to chief. She was a black woman, who, was amongst a lot of males, and she excelled. She was just she was it, So I just, she's been, she's smart. She's just a wonderful person, just inside and out. And so she's been my biggest influencer, and she's always encouraged me, been supportive of me and all my little things that I want to do. So yeah, she's the one.
Yeah, no, that's beautiful to hear. I'm glad to hear that. All right, so you kind of told me what attracted you to Fisk. You kind of got the offer of acceptance with the money that kind of sealed the deal for you.
Yeah.
So tell me a little bit about the Fisk 5. I kind of saw that in your bio, and tell me a little bit about that.
Yeah, so I guess when I first went to Fisk, I thought I was going to go to medical school afterwards. I thought I wanted to be an OB/GYN, My sister, though, she got pregnant and I was there for her deliveries and everything. And I was like, I do not want to work with these mamas. I think I'm going to do better off working with the babies, right? So I changed my major to nursing at that point, and Fisk had just recently entered into an agreement with Vanderbilt School of Nursing to establish a joint nursing program. So got all caught up because that was my sophomore year. I think I decided to switch. So I was a little bit behind. So I had to take some extra credits and stuff, to get on track. But there were 5 of us who completed this inaugural Fisk Vandy joint program. So we were kind of known as the Fisk 5. So it was great. It was an intense, accelerated nursing program. We did our first 5 semesters at Fisk, and then we went over to Vandy, the School of Nursing, for our last 3 semesters, and did their what they call their pre-specialty year to be able to sit for the nursing license boards and everything. So a good, intense, hard program. Probably the hardest thing I did in my life. Don't ever want to go back to nursing school ever again. But yeah, so that's us, the Fisk 5. It was 5 of us, and we did that, and we all successfully passed our boards on the first time. We had a 100% pass rate. So yeah, shout out to my Fisk 5 folks.
Yeah, that's amazing. That's
Yeah.
amazing. So they still have that particular program going on now?
They don't. It got dissolved, but Fisk did just enter into a new agreement with Austin P for a nursing program partnership. So I think that that's going to be great for them, for the students who want to, pursue nursing.
Okay, so I guess for the people who may not even know about it or may hear about it soon, I guess the partnership with Austin P. What would you say from your particular experience that you had with the partnership between Fisk and Vanderbilt that you could maybe say that people may want to look for with the new opportunity that they may have with Austin P? Even though you may not know much about that particular program, but from your benefits that you may have had, what would you say would be some good positive from even trying it out or looking to try to do it?
Well, first, it's going to give them the opportunity to pursue nursing, and then it's going to probably give them the opportunity to be exposed to more labs and simulation equipment, more state-of-the-art technology, things that they're really using now in the nursing field today just to help, educate the students and stuff. And also, too, I think it's going to be a good opportunity to diversify nursing. Of course, Fisk is HBCU. Austin P is not, so there is going to be that whole dynamic, of I don't know how their partnership is laid out, where they're going to take classes at or anything like that, but I think it's going to be an opportunity to do some bridging and building, of 2 different cultures. So a predominantly white culture versus, an HBCU, and just the students interacting, trying to understand each other, and just ultimately producing minority nurses, because that's what we need, more minority nurses to care for our population, because we have large minority populations, and people want to be taken care of by somebody who looks like them, so it's going to present a lot of opportunities for the students. I think it'll present some challenges too. Honestly, I don't necessarily know Austin Peay's faculty, how they are with dealing with minority students, who come from HBCU, especially if it was set up anything like ours, where we spend they'll spend the first couple of years and semesters at Fisk, Fisk ingrains in you some things, about blackness and everything. Yeah. So, I just think yeah, it's going to be some challenges, but it's also going to be very rewarding when they get through all of that.
Yeah, definitely. I didn't even think about that because you're
Hmm.
right. The history is instilled in you as a student, so for sure. Yeah,
Yeah,
that's
so
cool.
we like Black Power to the max, over there. So yeah, but I think it's gonna be good though.
Cool. All right. So I guess as you're finishing up with Fisk, so did you uh, you graduated from Fisk
Yeah, yeah.
University?
My degree ultimately ended up coming from Fisk. Yes.
Okay.
So yeah.
All right. So you graduated from Fisk University. What's next?
So after that, so the good thing that Fisk and Vandy had was we signed an agreement
Okay.
that said after we graduated from Fisk, we'd go and work at Vanderbilt. So we had guaranteed jobs when we graduated. So we
Definitely.
thought we were. I mean, it was great for us.
Yeah.
At the time, Vanderbilt had just started its nurse residency program, which is now how they hire new graduate nurses. So I applied for the pediatric nurse residency program because I knew I wanted to work with babies,
Yeah.
and get into that. So I applied for the critical care piece, which allowed me to get into the neonatal intensive care unit, as well as I got a chance to like rotate through various different critical care areas in the hospital, like the emergency room, the pediatric intensive care unit, the neonatal intensive care unit. So I tried to show them. You basically had to show them why you wanted to be in that area you wanted to be in so they can
Yeah.
choose you, because it wasn't a guarantee that you were going to get in that area.
Yeah, for
But
sure.
I did get into the NICU. I was very happy about that because I really, really wanted to work with the babies, and the premature babies and stuff. So that was next after Fisk. I started the residency program, started working at Vanderbilt Children's Hospital.
Yeah,
Yeah.
definitely. And that's very interesting. So the neonatal intensive care unit, that for myself is scary and like just the sound of it. And then I don't think I could work there myself personally. That'd be traumatizing experience for myself. I just go look at pictures and kind of look at the thing. So just kind of how is like the environment kind of working in that type of environment where you have these babies that are barely holding on.
Yeah.
Some may not make it. What's that experience like? Just kind of dealing with that stuff on the daily basis.
Yeah. So it can be challenging. It takes a very special type of person to be a neonatal intensive care unit nurse. So imagine, I was 21 when I graduated from nursing school, 21 with my first job in the NICU. And like you said, dealing with not, knowing if your patients were going to survive, at Vandy, we see the sickest of the sick, So I think my philosophy kind of helped me get through it. One thing I'll say is that we had the chance to do primary nursing. So what that is you can pretty much like kind of sign up to work with the same patient every time you work.
Okay.
Continuity of care. It's really good, for you to be able to do that. I had my first primary baby. He was premature, born at about like 26 weeks, I believe. So he was really just very, very little. His mom was young, his dad was young. Just a young African American couple, their baby, they were scared, I was scared, but for some reason I was just drawn to him and I signed up on him, to be his primary nurse. So I took care of him for about 6 months, every day that I worked. Yeah. In addition to, my other patients, but he was my main patient. And he died. And it definitely tore me up. I went to the funeral and everything, spent some time, with his family because they invited me and everything, it was a very traumatic experience. It was, but what got me through it was, after that, I would say, what got me through, other deaths and things was I started to kind of just change the way I viewed it a little bit. Because although it's very sad when a baby dies and stuff, for me, it's like they don't have a whole lot of connections yet, where, you think about when an adult person dies and all the family members and the friends and just all the relationships that they've established and everything that they're leaving behind, so I kind of just put it in comparison to that, like, okay, this baby hasn't yet had all of that, and so there's not as much, I mean, there's sorrow, but not as much and not as big of an impact on all the other people too. So that was just me, processing it in my mind to be able to get through it, for any
Yeah.
other deaths that I would experience. Um, but you also lean on your colleagues there that you work with too, my faith and spirituality, just to get me through it, and just knowing that God makes no mistakes, and everything happens for a reason, and I learn from each experience. So that's how I got through it. But it's still so rewarding too when you do. I had another primary baby, and he survived, And when he would come back for his appointments, his mama would call me like, "Hey, we're here at the clinic. You want to come see us?" So you have those success stories too, to help you get through it too.
Yeah,
Yeah.
definitely. Now, I was going to ask you about a success story as well that you might have seen, because I know it's a lot of uh, stuff like you just mentioned that very tragic. I almost made me tear up over here while you talking about it. But that's definitely sorry. And I was going to ask you, like, so you kind of mentioned the connection. So who kind of put that or gave you made that ring a bell to you, I guess, because that was my first time kind of hearing somebody talking about it in that aspect. So like, who kind of let you know that, okay, or told you that, okay, the connections, this baby doesn't have a lot of connections yet, or
Right.
who put the idea in your head? Because I'm just curious,
I
or it's
really
just something you thought
God,
about yourself.
yeah,
Yeah,
just in my
trying to
conversations with him,
rationalize.
just
Yeah,
trying to, rationalize it, figure it out, understand it, So I think that was just him just giving me my way of being able to deal with it.
yeah, no,
Yeah.
that's cool. I haven't, because that's just another way to think about it myself. And I just was thinking about it as you were talking. Oh, that's cool. Um, so I guess still on this particular subject, because it's interesting me. So how do you, like, how long do the babies usually stay in that particular unit?
Really, it just depends on how premature they are.
Yeah.
Yeah. So when you have babies born, 26, 28 weeks, think of a full term pregnancy is at least 37 to 40 weeks,
Okay.
So you think about how premature that is, when they're born at 26, 27, 28 weeks. Um, Babies, they can be in there anywhere from 6 months to a year.
Okay.
Yeah. So it's a long time. It's a lot for the parents to deal with. So it also is very helpful to have a primary nurse. For the parents too, because like this is someone who's always taking care of my baby, who they know know if there's any changes in their condition, anything like that. So yeah, it's a long road. It's a long road, but again, when they go home though, and they turn out okay, it's good
Yeah.
for the soul.
Definitely. I got just a couple more questions
Yeah, no,
on
it's
that,
okay.
because I'm just still curious, because I know you mentioned before that the OBGYN thing wasn't for you because maybe you didn't want to deal with the mothers.
Yes,
But this particular instance, you still have to deal with the family
you
with the
do.
baby. So I mean, this is a completely different type of experience where it could turn the wrong way.
Yes.
So how do you manage that, or how does that go? Like,
Yeah, with this, because you're not dealing with a mama who's in labor, who's,
oh, okay, okay,
pain and all that stuff.
yeah,
This is more so of you providing support to them to help them get through this time. Just talking to them and being honest with them, about expectations, what to expect, what we're gonna do, just and there's times when there's not good news to report, when the doctors have to come in and give them some bad news or something, but you're, as the nurse, you're there for them, being their advocate, helping them get through it, whatever resources they may need. Because sometimes you have them come from out of town. The babies can get life flighted in from other surrounding areas who don't have the capability to care for them. So then you got the parents that are here and they're pretty much displaced, and needing somewhere to stay, needing social work services. So you are, as the nurse, that's what we were doing too, caring for the parents too. So it's different, and they're very appreciative, because this just is a difficult time,
yeah, for
So
sure.
it's dealing with parents, but in a different manner this time,
Okay, yeah, I can
Yeah.
understand a little bit more from that aspect.
Yeah.
All right, so the next thing is just like, okay, hospital is expensive. I know these bills are in extreme amounts, maybe hundreds of thousands, maybe a million for some people in some cases, I'm sure.
Yeah.
Like, what can you tell me about the process about that, and like getting hit with these hospital bills after maybe even if the baby didn't survive, then they
Right,
still have the
right.
bills, correct?
Yeah. So with that, and that's another thing as nurses we try to do is connect them. Like at the hospitals, usually they have a department, the financial department. So if they don't have insurance, they help them with their applications. Well here, it's TenCare. If you need Medicaid, so calling in the financial counselors to help them and help them apply for insurance and stuff to get coverage so that they won't have those big hospital bills. So that's essentially like they do still end up probably with some sort of bill too, but just helping them to get connected to the resources to maybe help decrease some of that, that portion that they have to pay. There's also some organizations that are out there that will help them, especially with those costs of having to like stay in a hotel or something like that. Ronald McDonald House is one that was near the hospital too, that offers a place for them to stay and food and everything too, So there are a lot of things out there to help with some of these expenses that they do incur.
Yeah, no, that's cool. I didn't know about that.
Yeah.
All right, cool. So I guess after the NICU, what is kind of next from there?
Yeah.
I know you did a little bit of case management
Yeah,
work
yeah.
and stuff
So,
like that.
yep. So, transitioned out of bedside nursing. I still stayed at Vandy at the Children's Hospital. I became a NICU case manager. And so, with that, what I would do is now I'm on the other end of it when they're getting ready to go home and get discharged, right?
Mm-hmm.
And so, really just trying to make sure that those babies who may need oxygen at home, feeding equipment, because they might have a feeding tube or something like that, any sort of services, equipment, anything. So I would like connect with home equipment agencies, home health agencies to come into the hospital before they get discharged, to educate them on everything that they need for discharge. So it's really a lot of discharge planning.
Okay.
And trying to put everything in place for them to go home and to be able to survive at home, setting up appointments for them, follow-up appointments, all that stuff. So really managing all aspects of care, post-hospitalization. So that was my role as a NICU case manager. After that, I left the NICU.
Okay.
Just because, like, while I was there, I was in school as well, getting my master's degree in nursing and health systems management.
Yeah, I was going to ask you about that as well.
So I finished that degree while I was in the NICU. And so then I was like, okay, it's time for me to explore leadership opportunities.
For sure.
So then I interviewed for and got offered a position for an assistant nurse manager in the outpatient pediatric GI clinic, gastroenterology clinic at the Children's Hospital. So yeah, I became assistant nurse manager there and did that for a little bit. And I got into it because I had the thought that I wanted to be a chief nursing officer, the top person in nursing at a hospital,
Yeah.
So I was like, let me start here and try to work my way up. And I got in there and I was like, no, this ain't for me because it's too many politics. It's too much. It's too much to deal with, too many personalities. Everybody want this, everybody want that, and just too much. And I was like, nope.
Yeah, no, I can imagine. Even myself, my particular occupation is different, but it's definitely the corporate politics is like a rat race. It's just a mess.
Yeah.
So it kind of tends you to kind of do your own thing rather than participate and.
Yep. So how I got out of that, while I was an assistant manager, I was back in school again. Yeah, working on my doctorate in nursing practice. That's a terminal degree in nursing. So that one, you can specialize just kind of depending on which route you go, if you go from a bachelor's to that, but I already had a master's. So this just kind of was a postmaster's doctorate degree and just building upon my leadership from the health systems management. So got that, and then it was like, okay, so what am I going to do? I had a colleague there who was like, so what are you going to do now, that you've got this terminal degree? I was like, I don't even know. And so she suggested that I look into adjunct, being an adjunct instructor, because, she was like, hey, it's some really good side money. You got your full-time job right now, so just look into that. And I was like, I don't know. I ain't never wanted to be, a nursing instructor. Although, thinking back about it, it's coming full circle because I used to play school all the time growing up,
Yeah.
and I used to be the teacher, So I'm like, I guess this is what I was meant to do anyway,
Yeah, for sure.
But yeah, so I looked into it, and got offered a position as an adjunct instructor. Adjunct is basically like part-time, or they may just have you teach a course as needed. You might not have a course every semester. You may or you may not, So I was assigned one course and got into it and loved it because this course was issues in nursing and healthcare. So basically this course was exploring, I don't know, everything from minorities in nursing to, physician assistant suicide, like anything, we just talked about everything in that course. And so my students enjoyed it and they said I did a good job, so I was like, okay, I think I can do this for real.
Yeah, that's a wide array of topics.
Yeah, it
for
is.
Sure.
I mean, any sort of issues in nursing, we were exploring it. We had debates. It was a really good course, so that was my foot in the door to academia. And then I was like, y'all need help full time? And they were like, yeah. So I applied and I've been in academia ever since. And that was in 2013.
Okay. So what schools were you at when you were kind of with your classes?
That was at Tennessee State University.
TSU?
Yep,
Okay,
and I'm still there.
Okay, you still, okay.
Yeah.
Okay, I didn't know. That's my alumni, so shout out to TSU.
Yeah, shout out to TSU. Yeah,
okay.
Been rocking.
Yeah, that's what's up.
Yeah.
All right, so tell me this. So I know for yourself, even when I was at TSU, the instructors seemed double your age. So tell me, like, your experience coming from, like, the students as well as maybe your peers that were around, like, because your students may look at you, may be able to relate a little bit more. That's probably from your class. Sound like it was probably interesting and fun. A lot of debate and stuff like going on, or maybe it could have been a little bit different. So how did your students kind of react to you, being that some of them probably look older than you, some probably were older than you, and then I guess you're so young, and then maybe from your peers that I know at least half of them are double your age.
Right. So yeah, I was 26 when I started. So yeah, students, I didn't really have a problem out of students though, because I knew what I was talking about. It's one thing to be young, but it's another thing to be young and knowledgeable and credible,
Yeah, for
so
sure.
I never really had a problem. I was able to relate to my students, so but then I still had older students, too. But I was a professional, never crossed any boundaries or made it to where they thought I was like one of them. I'm a nurse, but I'm your instructor though, so we've got boundaries, I've always kept it that way, so that they know. At the time I was Dr. Hines, Dr. Hines don't play, no, I don't. Like, we can have a good time in here, but yeah, you're going to learn too, and you're going to respect me too, so
no, for sure.
I just kept it that way, and when I introduced myself, that's the way I introduced myself, as their instructor, so I was well received, even my colleagues, they were happy to have, some newer, fresh blood in there, fresh eyes, just someone coming with a passion for wanting to help out, they're like, hey, you want to do this? Go ahead, like, yeah, we've been doing it. Let's get somebody else in here to do it, so committee work, all that stuff. So yeah, I was well received, well respected. I haven't had any problems because, again, I do my work too, and I put forth a good effort, and I just, I'm competent, and I make sure when I go in front of my students, I know what I'm talking about, so it really wasn't a problem.
Okay, no, for sure. I just curious because some people are like very judgmental, and then until you maybe start speaking and show them, then their opinions change. So I was just curious because you're definitely very young, you know what I'm saying, at that time. compared to like your colleagues, I would say,
Yeah.
and even like the students. I know you had some older students than
Yeah,
you
I did.
yourself.
I did. But like you said,
Yeah.
I always established myself as who I was, in my position. So it never really got questioned.
Yeah, no, that's
Yeah.
cool. I'm glad to hear that.
Yeah.
So now you're currently a tenure professor.
Yeah.
All right, so I guess tell me a little bit about that, just being a tenure professor. Like, what does that mean?
So, and when you get into academia, there's different ranks.
Okay.
Yeah, so you can start off like as an instructor, then you're assistant professor, associate professor, and then you get full professor,
Okay.
right? So I just got promoted in July to full professor. That's the
Okay.
highest, that's the top rank that you can get, So I'm very happy about that
Yeah.
because you have to demonstrate excellence in 3 areas, and it's teaching, scholarship, and service, and then tenure as well when you go up for tenure. So when you become tenured, let me see how I can explain this without. So basically, you've basically proven yourself, and shown your worth to the university to where they don't want to get rid of you,
Okay.
right? And tenure comes with certain protections, essentially. Not like you can never be fired, but it's going to be more of a challenge to get rid of you, so it's gives you a lot of good job security, because you've reached that level where you've shown to the university you are an asset to them, and they want to keep you. So you basically, like I said, you can get fired, but not very likely unless you're just doing something where they have to do like a post-tenure review and you've just really shown your tail,
Yeah.
So, but it's a both of them getting promoted, getting tenure, all that is looked upon very highly, by your colleagues everywhere around the world, because basically you've established yourself as this professional, at this high level, and you've demonstrated your worth, so.
Yeah, no,
Yeah.
congratulations. That was
Thank
recently
you.
this year in 2020?
2020 was professor and 2019 was tenure.
Oh, okay, nice.
Yeah,
Nice.
yeah. So I'm proud, I'm happy, and I definitely think that I'm an asset to the institution. So
Yeah, no, definitely. So tell me, I guess, a little bit during this time as well, there was something, I guess, with the Global Health Service Partnership.
yeah, okay, yes. So, I'm gonna go back to this is like I think that military child in me who just moved around a lot, and wanted to do something different, So I was in my first year at TSU teaching and just driving in the car and heard this little Peace Corps radio advertisement, and it was like, and I distinctly remember it was like, would it be crazy if you just packed your bags and left? And I was like, wait a minute, I need to do this, literally. And I was like, okay, I just went home that same evening and just Googled it, like Peace Corps or whatever. And the first thing that popped up was this new program that they had just started called the Global Health Service Partnership. And it was for doctors and nurses who've been educators, to go over to a country in sub-Saharan Africa to teach either medical students or nursing students. And I was like, man, I qualify for this because I'm an educator now,
Yeah, for sure.
So I was like, oh, this is awesome. And it was just for a 1-year commitment because usually Peace Corps assignments are 2 years, and it was in, like an institution doing what I was currently doing, something that I enjoy doing. So, yeah, I applied for it and interviewed and got offered a position as a volunteer nurse educator in Tanzania. So that's in East Africa. So, yeah, and it's a partnership with Seed Global Health, Peace Corps, and PEPFAR, which is just the President's Emergency Plan for AIDS Relief. So all these 3 organizations working together to send doctors and nurses over for a year. So I left. So I started at TSU 2013. So I finished that academic year, 2013, 2014. So I left to go to Tanzania in July of 2014 and came back in July of 2015. Yeah, man, life changing experience.
Yeah, just off of commercials.
Just off of a Peace Corps radio advertisement. I'm like, so
That kind of reminds me of those late night, when you get them commercials late night, try to get you into Nashville out of diesel college,
yes,
some kind of
yes,
college,
yes.
doing funny commercials.
Yep.
That's what's up. So just off the whim, that's cool. So
Yeah.
I guess as your experience as a volunteer nurse in Tanzania, how was that experience? Like, what was it like over there? Because was that your first experience just out of the country?
Well,
Or-
out of the country as a professional.
Professional,
Yeah.
yes, correct. Yeah, that's what I meant.
Yeah. So, man, listen, it was, first of all, when I first got there, I was like, this is Africa, this is the soil,
Oh, yeah.
like, just
Touching the
like,
ground.
I couldn't
Can't believe
believe
it.
that I was in the motherland, so it was, that was just amazing anyway, just to step off the plane and be like, okay, I'm here for real,
Yeah.
because you don't ever think that you're gonna go to Africa, or anything like, yeah. So that, just had me like, oh, yeah. So, but I was at University of Dodoma School of Nursing,
Okay.
and I was teaching neonatal and pediatric nursing, my specialty. And it was so different going to the hospitals, because I did clinical here in Nashville where I take students to the hospital and stuff. I did the same thing there. You're not
Hospitals
prepared
are
for
different.
Oh, they're way different. Now, let me just back up for a minute, because I don't want everybody to think like everywhere you go in Africa is like some third world where it's not developed and everything like that, because that's not true.
You were sent to like a specialized location because they had a need for your assistance,
Yes,
and that's why you were.
yes,
Okay, I understand what you
yeah,
mean. Go ahead.
because there, even
Advanced.
in Tanzania, there's some good hospitals and stuff, and good technology, so there are places that they're advanced and they're developed too,
Modern tech. Yes.
Now, I wasn't in like rural Tanzania either. I was in a small town, right?
Okay.
So they did have some health centers that were, mid-modern, but I did go to this hospital, Dodoma Regional Hospital, where it was not developed or anything like that.
Yeah.
There are like multiple patients in one bed, and I was on the maternity ward and the neonatal ward. Now in the neonatal ward, it was better with maybe just one mama, with her babies or whatever. Here in the US, we have like the incubators and the beds and everything where we can warm the babies, keep them heated, keep their body temperature up. But they're,
Missing that equipment.
Well, actually not even missing it, because they had it, but no one had ever showed them how to use it. So I did though.
Oh, okay.
But before that, it was just skin to skin, which we do here in the US too, but it's just the mamas warming the babies up on them, on their chest and stuff. So, but on the maternity ward, or I should say, postpartum unit, where after they've had the babies, that's where you'd see the multiple mamas and babies in one bed, just not the greatest conditions,
Yeah.
So it was different to see, but it's really a matter of just adapting to what's there, I wasn't going in with the mindset of trying to change things, because I, as one person, I'm not going to, be able to change stuff like that, but I went in with the mindset of, at least I want to educate the students on what to look for that's normal, so that if they see something that's abnormal, they can say something about it, because you have to know that you're not going to be able to teach them everything and teach them to do it the way that we do it here,
Yeah, no, for sure.
Yeah. So it was a good experience, because the students were so appreciative, just of me being there and just sharing my knowledge with them. And I'm not like coming in there like, oh, we do it this way in the US, you have to do it. I'm not trying to impose that upon them. I'm like, what do you need from me? What do you want me to teach you that's going to help you function where you are,
Yeah.
So, but it was good though. I enjoyed it. The students enjoyed it. My colleagues enjoyed it, that I was working with. So it was really good.
Yeah, so that was like an amazing experience, just coming from just two separate, complete different cultures that
Yeah.
are so different in dynamics and things like that. So I guess how has that experience kind of changed yourself, or maybe your outlook from before that particular time, before you even went over there? What takeaways do you may have
Yeah.
that you think about that
Man,
from that experience?
so many things, but I think the biggest thing is I realized how ignorant I was as an American.
Describe that a little bit more,
Yeah,
because I think we
because
all are ignorant.
yeah,
To be honest,
yeah,
especially because we're this particular country is so privileged in regards to a lot of
yes,
things that we don't realize until we go elsewhere
right,
to see the impact that others
yeah.
have.
And that's what it took for me. I was like meeting so many people because there's lots of volunteers who come. I'm meeting people from all over the world, and they're speaking multiple languages and everything, and I'm like, shoot, all I know is English.
Man.
I know a little Swahili because
Yeah.
I had to learn a little bit of the language so I could function there, but I was like, we just live in this little bubble here where all we know is us, and we don't even care about what's going on other places. So that experience really just opened my mind, and really made me think about others outside of the United States, and how can I help others, but not help others to where I'm trying to make them do it like we're doing it,
Yeah.
but I want to be knowledgeable about affairs that are going on in other countries, how people are being impacted. I want to step outside and help, and really do something. So it just really changed my mindset. And I'm just like, dang, we just living over here, and like so much other stuff is going on in the world, and we just act like it's just all about us.
Yeah, everybody's caught up.
Yeah.
For sure.
And I'm like, everybody else is people trilingual, just they just so much more well-rounded than we are, so
Yeah, I know a couple of people myself personally that speak at least three languages
yeah.
fluently. And I'm just trying to pick up Spanish myself,
Right,
just on the
right. We
humble.
trying to Rosetta
Yeah.
Stone our way
Yeah,
up to
exactly.
learn something.
But it does make you think a certain type of way, because people want to be informed, so they are progressively trying to get more knowledge, seek out and break different language barriers, so that way they can open up the communication with information for themselves and maybe their family or whatever else they may got going on.
Right.
So that's definitely important. So I know you also had like your first abroad study
Yeah.
last year. Is that right?
Yes. So coming back from Tanzania, I just started getting more involved in stuff, international stuff. So I connected with our Office of International Affairs at TSU, and that's how I got into study abroad.
Okay.
The director there, Dr. Jewel Wynn, just kind of took me under her wings, and really has shown me a lot, directed me in the right directions, given me opportunities, to do study abroad trips. So I'm so thankful that I met her, so had my first study abroad trip to Trinidad and Tobago last year in 2019. And actually, it wasn't even for nursing, I actually taught an interdisciplinary studies course. And, interdisciplinary studies, it's just like, I'm not gonna try to offend anybody, so let me say this the right way. It's like kind of exploring all different subjects. I'll say that.
I got you.
Yeah. So I had students from all different majors, because it's open to anybody. But this course specifically focused on like societal transformations and the impact that it has on gender in the African diaspora. So places outside of Africa, basically.
Oh, what is that? Just repeat that. What did you just
in
say?
the
again?
African diaspora. So that's
What is that?
places
That was way
outside
over my
of
head.
Africa,
Okay.
where African people are outside of the continent of Africa.
Okay.
Yeah, so Trinidad and Tobago, is considered the diaspora as well. Any place
Okay.
really outside of Africa.
I got you.
Yeah,
I got you.
yeah. So, and ironically, this was a course, it was all males who
Yeah.
took the course, learning about gender, the impact of women specifically, how slavery, racism, capitalism, all these different isms, their impact on women, So they basically had to figure out which ism they wanted to study, on the women in Trinidad and Tobago, and interview these different people to talk about how they feel about this and how it has impacted
Quick
them.
question. What was the most popular ism between the males that they want to figure out from the women in Trinidad and Tobago or whatever? I'm not sure of the ism, so I don't even know which ism they would even be
Right.
studying. But what was
racism.
Oh, okay,
Yeah,
okay.
yeah. So and of course, Trinidad and Tobago is a place that's full of black people.
Yeah.
Yeah. So just
Is racism prominent down there?
it's not like it is here because they've done so well as a country because there's a lot of black people there. So it's not like racism we experience here in the U.S. I'll say that just because it's a country full of black people.
Yeah, I understand.
Yeah. But so they looked at it from different aspects, like the education systems. How women have been impacted,
Oh, I got you.
colonialism and stuff. Just looking at it from those aspects. But it was very interesting to have all males, looking at it. But and they did their final presentations to us on their. I'm not gonna call it like research, but on their project because we were only there for a couple days, So there's only so much that they could do. Yeah, but it was a good experience just to take students abroad. I'm glad I didn't have to go alone on my first trip, because we did it in conjunction with from the Heart Foundation. So they take middle and high school students as well.
So you all had like a younger.
Well, not me.
Okay.
I did the college students. Yeah, but there were some instructors and Dr. Jewel Wynn, and her foundation where they do the middle and high school students. Yeah.
I have a question about that. Sorry to interrupt.
No, it's okay.
No, so tell me, how did those particular high school and middle school students, I guess, get that opportunity? Yeah.
Well, it's pretty much open to any of them, but they do have like certain schools and partnerships that they have too, where they, the students are filtered to them that way, but also they have camps at TSU in the summer, like music camps and stuff, because this foundation too is heavily focused on music and the arts and stuff. Yeah.
Gotcha.
So those students, that participate in their summer camps and stuff too can get that opportunity. But I had my niece signed up for the Dubai trip, but it got canceled due to COVID. So there are opportunities for students here in Nashville, middle and high schoolers, to get involved early on and study abroad and just getting exposed to other different countries and stuff.
Yeah, and that's important especially for the young people to kind of move and see different things, especially get out of your state or go to travel to different states, because sometimes people live for years and haven't even went to the other side of town. And it's a shame.
Right.
Now, okay, so I guess how you say the TSU, the camps, I guess summertime or just maybe.
Yeah, or even just going onto the TSU website and looking up and searching for the Office of International Affairs, and they have information on the website about the programs for the youth.
Yeah, definitely. So, exposure is great
for
everyone.
I know. I was so glad I stumbled upon that because I was like, I want to get my nieces and nephews involved in this and really get them exposed to stuff,
Yeah, because that stuff can be life-changing.
It can be.
That's great. So you all, I guess, we're going to go to Dubai this particular
Dubai
2020,
but May 2020 we were scheduled for that, but then COVID hit, and everything got canceled. So.
Yes. Unfortunate, this COVID. So I guess from your I know this COVID is not your particular expertise, but what information can you kind of share with us about COVID? Maybe what you have noticed in your profession? Any advice or?
So of course I'm gonna say, because I'm a healthcare professional, everybody needs to wear their mask. Everybody needs to wear your mask, wash your hands. Stay 6 feet apart. Those precautions. I'm always gonna be preaching that. I know that now there's some skepticism about the vaccine, and this is just my opinion about all of this. When COVID first hit, it's like everyone wanted a vaccine, right? Oh, we got to get a vaccine so we can get back to normal, you know what I'm saying? And now that the vaccine is essentially here, now it's like, oh, they produced this too fast, I don't trust this, and I'm like, what are we gonna do? either you is or you ain't, So I'm like, my thoughts about it are like, okay, yes, it was produced quickly, but this is probably for many of us the first time in our lives where we've ever experienced anything like this, right? The last pandemic, was before many of our times, they didn't have the technology back then, the advancements, the years and years of lab work that have been going on, to be able to produce a vaccine that fast back then. So I do understand, clinical trials and, people not feeling comfortable, with taking it and wanting them to do more clinical trials and stuff. So, I'll say first that people need to do their research and look up the clinical trials that have been done. So far, I believe Moderna has been the one that has, at least extended their clinical trials to people who have comorbidities, 65 and older, African Americans, just a more wide array of individuals, So before we just go out there and be like, oh, I don't trust this vaccine and stuff, and I know that Black people have a hard time trusting the healthcare system. I know that. I'm Black, I'm in healthcare, I know all of that too, but I don't want us to just go out here falsely spreading information either, and scaring people, I think it probably got some bad PR initially, the vaccine stuff, from the Trump administration and stuff, and them saying, oh, we're going to get it out quick. But they probably should have been like, also lab work has been done for years and years on this type of stuff, for us to try to get things produced quicker, So I understand people's skepticism, but I also want people to really be educated, and go and look up the clinical trials for this stuff, and make yourself an informed decision on whether or not you want to get the vaccine, when it comes out and when it's time for you to get it, So that's kind of my thoughts about it, I mean, I'm going to get it.
Yeah, that was going to be my next question. Are you going to get the vaccine?
Yeah, when it's my turn, I'm going to get it. Yeah. Just because, I mean, for me, there is no other alternative. I mean, the other alternative is just always worrying about whether or not I'm going to catch it, and still there might be a chance of catching it, just like with the flu shot,
yeah.
I know, but,
so I know that.
I don't know, it's difficult, I know people, I know it's difficult, but like I said, before making a decision or just completely saying, no, I'm not going to get it, just do your homework and don't just listen to what everybody says. Don't listen to what Facebook says either.
No, for sure. So for those people who are interested, I guess there's like 3 main vaccines that are kind of out and prominent. That's the Oxford, Pfizer, and Moderna, the one that you mentioned.
Yeah, I think it might be, I don't want to misquote the first one. I feel like it might be AstraZeneca or something. It might be, but that one's not going to be, the efficacy of that one is not enough. So that one's definitely not going to be pushed out. Pfizer and Moderna are the other 2, and I know the UK and stuff is already probably, I think starting next week, they're going to be distributing the Pfizer one. Yeah, so,
And to be honest, myself, because I know there's going to be a point in time where the vaccine is going to be mandatory. So I'm pretty sure they're not going to allow you to send your kids to school if they don't have the vaccine anyway. So I know people are probably trying to figure out, I'm not going to take the vaccine or get the vaccine, but I'm pretty sure no matter how it comes, I'm thinking everybody's going to have to require to take it some kind of way myself, unless, I don't know.
Yeah,
I'm not an expert. I'm ignorant to all this stuff, but
I think certain places might mandate it for their workers, mandate it, I mean, or maybe they'll treat it like they do the flu vaccine right now. Sometimes at some institutions, you can get it or you don't have to get it and you have to wear a mask, as a healthcare worker, So some mandate it, some say if you don't get it, you got to wear your mask, So I think it might be still a little too early right now for them to know whether or not they're going to mandate it. But like you said, I mean, I definitely think it's eventually going to be on that list of immunizations that kids have to get, for school and everything and all that stuff. So it's our reality, you know?
Yeah, because I was just looking at the news here recently, and they were just talking about this Tennessee spike in COVID cases, and we just hit like another record as of just a couple of days ago, in just the amount of new cases and things like that. So it's definitely still on the rise. So it may be in your best interest to. I'm not an advertisement for
Right.
vaccines, but
Yeah, me neither.
I don't
I'm
even want
just
to take it.
do
But
your
yeah, just
research,
to
you
be
know,
safe and
just
yeah, do your research and be safe for sure.
yeah.
So thank you for that information.
Yeah, no problem.
I was going to ask you, I guess, the Fulbright Scholar Award.
Yeah.
Tell me about that.
Yes, because I
That's
am
very
actually
prestigious.
leaving next month to go
Okay.
back to Tanzania. Yeah.
Okay.
So me still trying to do my international work, you know. When I first went over to Tanzania, the organization Seed Global Health really instilled in me the notion of capacity building.
What
I
is
don't
capacity building before you go
Yep,
into?
I'm gonna
Okay.
explain it.
Okay.
So I don't believe in mission work. Okay,
Okay.
so mission work is like you go in, you do something with people, you leave, and then the people are left with like nothing,
Yeah.
right?
Yeah.
Because you are the only one who knows how to do that stuff, right? So you probably leave them off worse than when you came in because they can't even sustain whatever it is that you did, right? So with capacity building, you are basically educating the people there who can provide these services. So, like, that's me saying, I'm a nurse educator. I want to go and work with other nurse educators, you know, teach them what it is that they want to know, you know, what's going to help them educate their students and stuff, share some of my knowledge with them, but let them be the ones to do it and keep doing it while I'm gone. That's what capacity building is you are essentially giving them the tools and resources to be able to keep doing it when you're no longer there. So that was really instilled in me. So when you get into academia, there's lots of different awards and all these different things that you can do, you know. So me just really being heavy into international stuff, one of my colleagues at TSU, she was like, have you ever looked into Fulbright? And I was like, no, I was like, I heard of it before, but no, I haven't looked into it. And she was like, I think you should look into it because I think that's right along your alley, you know, what you want to do. And so the Fulbright program is basically there's a program for scholars and there's a program for students. And so scholars being, you know, individuals who are in academia, who are educators and all that, and researchers, you know. So I applied for this Fulbright Scholar Award. It is a very, very prestigious award, very competitive, highly sought after, you know, by people who like to do international work. People apply for this award multiple times, sometimes before even being selected, you know, and I am so honored and thankful to have been selected on my first attempt, you know, on my first time I applied for it. But yeah, I'm going back to Tanzania, back to that nursing school that I was at, but this time I'm working with faculty. First time I worked with students. This time I'm working with faculty and trying to show them and help them revise their curricula, do some faculty development, just share with them all the knowledge that I've learned over my last, 8 years of being in academia. So just talking about different teaching and learning strategies, really working with them on democratizing the classroom. And that is, so in Africa and probably in other places too, but you have a lot of where it's, I'm the instructor, you're the student, you gotta listen to me lecture. Nobody asks me any questions. It's just, I'm gonna get up here and talk, and that's the way it's gonna be, you know?
Hold on 1 second before you start any further there, because a lot of people's college experience is like that now.
Yeah.
With I'm not to say anything with a lot of the foreign professors.
Yeah.
I guess maybe because that might be their own cultural dynamic and what
Yeah.
they're used to.
Yeah.
So that makes sense to me now as he just said something.
Yeah.
But continue. I'm sorry, I didn't mean to cut
No,
you
no,
off.
it's okay. But yeah, so really I want to give them or just work with them and show them other ways, I guess, that education and knowledge can be imparted into students without it being such a hierarchy of I'm the instructor, you're the student. You know, like we can have dialogue, you know, as instructors and students can learn when the environment is conducive to learning. You know, when you just up there like, okay, you gotta listen to me, I'm gonna lecture on this and don't ask me no questions, you know, the environment just really is hostile,
Yeah,
you know,
for sure.
and so nobody can really learn good that way, you know. So that's what my goal is this time around. So unfortunately, I was supposed to be gone already, but COVID,
Yeah.
so my start date got pushed back to January. So me and my family are leaving next month, and we'll be back in August.
Well, okay,
Yeah.
that's cool. That's gonna be exciting. So,
Hmm.
when you go to Tanzania, are you coming with like your own created curriculum, or are you helping like create a curriculum there with the faculty, or do they have their own, or you all just kind of improvising together, or what?
Well, so when I was there the first time, one of the other things that I did was to help them develop a Master of Science in Pediatric Nursing curriculum. So
Is
they
this for
want
like a
me.
school? So
Yeah.
they would graduate and get this particular, go through this curriculum
Yep.
that you helped create.
Yep.
Okay,
Yeah.
that's amazing.
So yeah, thank you. So now we are just working to revise it. You have to review your curricula ever so often, your courses, everything, just to keep up with new practices. Make sure you're teaching the latest and greatest information. All that stuff. So just helping them to revise whatever other curricula they need, but specifically that one for the masters in pediatric nursing, and helping them to develop some short courses for a type of nursing student it's called an in-service nurse. So students who are going through other programs, and just trying to get this specialty focus, so helping them to develop courses focused on neonatal and pediatrics as well. So yeah, just that
Yeah.
type of work with
No,
them.
that's pretty cool. So I guess after you go through this next experience, you come back in August. What do you plan to kind of gain from this experience? Because you already got like a previous experience, and then now you know what you want to come in and do.
Right.
So what do you expect as like the end all result once you come back in August? Like, what are you kind of expecting from, I guess, your performance or whatever
Yeah.
you got going on there?
Yeah, so I am really hoping to establish myself as a faculty development specialist, um, particularly with nursing education, and really do some consulting locally, nationally, and internationally, and just working with faculty at various schools of nursing. And that's what I have a passion for. I've been working with our new faculty that we've hired here at TSU. I think that I have a lot of knowledge to share, just creating materials and things for them to use to be successful. The whole curriculum development process is intense, so just whatever tools and things that I can create, and share, that's what I'm aiming to do. I'm also aiming to establish a nonprofit. My time abroad in Tanzania really showed me that African Americans are very underrepresented in this type of work, international work. So and this is a real thing, but it's the whole white savior complex. That it appears as though, and don't get me wrong, like several people that I've met over the years and stuff, who are doing this type of work, they are white, and because more of them engage in this type of international work and just stuff like that, but our African brothers and sisters kind of like look to them, all the time. And I'm like, well, there's several Black educators and Black doctors and nurses and people who are professionals. It's several of us out here too. And we are just as competent, we can do this type of work. So I'm aiming to really increase our presence, and engage in mutual exchanges with our African brothers and sisters, and just really showing them that we're out here too, and we ready to help y'all too.
Yeah, no,
Yeah.
for sure. Yeah,
Yeah.
because I know a lot of those countries are European colonized early,
Yeah,
and still
yeah,
to this day have those type of governments and things like
Yeah,
that.
and just that mindset. And again, I'm so appreciative to everybody who does this type of work, but I want us to be represented out here too, and know that we're out here, we can do this too.
Yeah, so I was going to ask you. I guess since you were kind of talking about that, like, what is the reception from the American African American? I would say when you go to Africa or Tanzania, like how do they receive you as just because you're not Tanzanian?
Right.
So they just know you as an American. Some how people have stereotypes for Americans and things like that. So
Right,
how was your
right.
reception? I guess or people to receive you at first. I'm sure they probably loved you when they know you, but
Yeah.
what was their I guess expect or Do they have any judgments, I guess, upon sight?
They didn't. Several of them, most of them thought that I was Tanzanian.
Oh, okay, yeah,
Until I opened my mouth to
yeah,
start
yeah,
talking. Like I said, I did learn Swahili.
yeah,
So I can communicate. But once I started talking, they're like, okay, no, you're not Tanzanian.
yeah,
They're like, where are you from? I'm like, America. They're like, oh,
yeah.
okay. So, but I was well received. I really was. I didn't experience any problems. I know here in the U.S. we have this sort of thing like, oh, Africans think they're better than us, and
Yeah.
all. But I didn't get any of that while
Yeah.
I was there. I was welcomed with open arms. They were so happy that I was there. And I was happy to be there. So I think we definitely have some bridging to do there too between Africans and African Americans, just to get rid of all that whole
Stereotype stuff.
of they think they're better than us, or they're lazy or whoever or whatever. Like, no, I didn't get any of that. Like, yeah. But
Oh, okay.
Tanzania, I think though, where you go in Africa might have something to do with that. Tanzania is in East Africa. Tanzania is a very peaceful country, not a whole lot of anything going on, besides people living in harmony, So I just think it has a lot to do with where you are. But again, showing up, and working together can help kind of dispel some of those myths and those stereotypes and stuff.
Yeah, no,
Yeah.
that's cool. So I'm glad to hear that.
Yeah.
'Cause I know it probably does depend. 'Cause myself being from West African, well, not being from West African, I'm Nigerian.
Right.
So I know there could be some little stereotypes there that I've
Yeah.
noticed just from my own culture. That
Yeah,
are
about Nigerians, there are some there's some
Yeah.
things that's floating around.
Yeah, no, but that's cool. But love to everybody.
Yeah, absolutely.
And then I guess the nursing education consulting business, is that the
Yeah.
nonprofit or that's
Nope,
something different?
That's something different.
Okay, so
Yeah,
tell me about
yeah.
that first, then
Yeah.
I'll have you go into the nonprofit.
Okay. So I am, and I'm, just getting into this, really trying to get this business going with being an independent nursing education consultant, and going to various institutions and just doing faculty development, in those three areas of teaching, scholarship, and service, But I don't want to just limit that to here in the U.S. I want to go international too, and again, just share my knowledge, and really work with faculty who are in nursing education. I got to stay in my lane, stay in my
Yeah.
ministry.
Yeah.
So that's what I'm skilled in. That's what I'm good in, and that's what I want to continue to be good in and just continue to share my knowledge about. So yeah, I'm hoping, of course I'm getting ready to leave now, so it's all still in the works, and hopefully when I come back, I can, really go full-fledged into that, and then the nonprofit is what I was saying about having other Black professionals and stuff go over and like working with the doctors and nurses and not even just limited to doctors and nurses, like every profession. Like I know somebody in every profession,
Yeah.
and I've already, and it just started as my thought, and I put a little thing out there on Facebook like, hey, would my friends, would y'all be willing to go to Tanzania like for 2 weeks, to do something,
Yeah, no,
and I got
sure.
a lot of responses, and so that's when I was like, okay, I know enough people to really make this thing work and get us over there, and take trips there where we work with them and give them what they need from us, whatever it is that they want to learn about, not us directing the learning, let them. And then they show us their country, let's go on safaris, let's actually do things together where we can learn about your country too, so it's supposed to be like a mutual exchange, so that's what I'm hoping, to get started too when I get back.
From the nonprofit.
Yeah, for the
Yeah.
nonprofit.
Yeah, no, that's cool.
Yeah.
No, I'm glad to hear that. So,
Yeah. So I got a lot of things, in the works.
yeah, no, I'm glad to hear that. Well, I ain't gonna take too much of your time. I really appreciate you coming in today and chopping it up with me. It's definitely been a pleasure for sure.
Yeah, I enjoyed it.
And then hopefully once you get back, I can kind of get you back in, and then we can talk about some of your experiences over there, because I know you got a lot of great stuff going on.
Yeah, I'm sure I'll have a lot to tell then. So yeah, but thank you for inviting me, and just thinking enough of me to invite me to come and talk about everything. So I appreciate that.